Thank you, and good morning, everybody.
I'm really delighted to introduce David Zarembka. I'd like to say a little bit about how I got to know him. He's quite well known in Quaker circles because he he was involved with the Africa Great Lakes Initiative starting in 1998. And that's done amazing work around trauma healing and other things to really benefit that region. He's also really knowledgeable about Africa. He started there in 1964 after I think he was at Harvard working at a refugee camp. He has been married to two women from Kenya, not simultaneously, and he's gotten to know the country really, really well. And his book called A Piece of Africa is one of the most readable and interesting books about that region that I've ever read. And I had the opportunity to go to Kenya in 2012 for the World Conference of Quakers, of Friends. And I learned there that there are more Quakers in Kenya than there are in the United States. And so it's an interesting country. I was blessed to be able to go to a little village called Turbo, where I met David face to face along with other Quakers. And I just want to share one story. The Quakers did a lot of poll watching during the elections in Kenya. And there was a lot of violence. And I think that their presence helped a great deal. And while I was in a meeting at Turbo, I met a Muslim leader named Isa. And he told me that during this period of violence, the local Quaker church had really embraced the Muslim community and invited them to stay at the church and amongst them so that they would be safe. And as a result, he and the Quakers were really quite close. So what I was impressed with in the work that David did was the way he brought healing and peacemaking to what all the work that he does, and also helping Kenyans to learn how to become more active politically. But today he's going to talk about a subject that fascinates me, and I'm really excited to hear what he has to say about COVID in Kenya and Africa. And so I don't want to take up any more time, but I'm just so glad you're here, David. And I think it's a real blessing to be able to connect with you thanks to the magic of Zoom. And please, one last thing I have to say. I was invited along with others to his home, and I got a taste of Kenyan hospitality. I have never been welcomed at anybody's home with the exuberance that the Kenyan women showed, singing to us and welcoming us into their home. I just came back feeling so much love for the Kenyans, thanks to David. So thank you, David, and please give my warm greetings to Gladys.
Well, thank you, Anthony, for that introduction. I'll just say that I was in, as he said, I was in teaching Rwandan refugees in 1964-65. Then later I was in the Peace Corps in Tanzania and Kenya. And then I started but now girls secondary school in Kenya from 68 to 70. And, but I've always been very involved with Africa. And Gladys, my present wife, we met in Bethesda meeting in Bethesda, Maryland, where she's a Quaker from Kenya. And so after my mother died and her mother died, but her father was still alive, we decided to come back and sort of help take care of him, which is what you're supposed to do since Gladys is the oldest child in that family. So we moved back here in 2007 and have been living in Western Kenya ever since. Right now, we're taking care of 4 of our grandchildren, which is what grandparents do in Kenya. Although one of the mother of 2 of them also lives with us, so it's not like we do it all by ourselves. And as Anthony said, I've been very involved with peace work my whole life. I was a conscientious objector before before the Vietnam War. I'm 77 years old, by the way. And then I've been a war tax resistor ever since that time also. And so I actually came to Quaker meetings because of their peace testimony, what I read about what they have been doing in their history and things like that. And I like them ever since, and that was when I was in college. So I've never I've been with the Quakers ever since. Now today's I want to talk about COVID-19. And the subject, the sub root issue I want to talk about is how Africa is still considered the bottom of the world, improperly, as I think anyway. And in the 1970s, they're on, it's kind of not polite anymore to be straightforward racist, although it's come back recently in the United States. But still, it's very common to say extremely racist ideas about Africa. And that's the subcontext that I want to put under my talk and show how this has been affected about COVID-19. When COVID-19 hit the world in March, April, Melinda Gates said that Africans would be dying in the streets. And there were projections of millions of Africans would die. And the reason for all this was that the healthcare system in Africa is very poor. In many places, almost non-existent supposedly. And people are poor. People live in slums where, in the cities like Nairobi or Johannesburg, where the virus could just move quickly from one person to another, and the death rate would be just fantastic, and the rate of things. Well, now I'm supposed to share screens. Let me share the first screen that I can find. This is the chart the charts are out every day of the cases in the United States versus the cases in Kenya. And this is normalized by population. So this is for every 100,000 people in both the United States and Kenya. And you can see what's happened in the United States, which you probably all are fairly well of. But if you look at the Kenya, it's so low that it hardly gets off the bottom line. And when I did the estimate recently, the rate per 100,000 people is 45,000 times more than the rate in Kenya. So the question is, why did Africa do so much better than the United States? And we could also do Europe and lots of other places. So there's been a tremendous amount of speculation and concepts put out. Now, I'll give you a few of them. One of them is genetic. Some people said, well, there must be something in African genes that keep them from getting the virus. A sub one that I just heard about that is the reason why Americans and Northern Europeans have such a high rate of COVID-19 is because they have Neanderthal genes. Well, that's a really interesting one, except, well, as I will show in a minute, it's pretty much bunk. But another one is, well, Africa is a very, very unhealthy place. So people get sick all the time. And because they get sick all the time, they have more immunity to something like the virus. That's another one. Another one was that in Africa, TB is still fairly common. And uh, every child is inoculated against TB when they, in that list of shots that all kids get. Now the problem with that theory is that they do that in India also, and India has been one of the worst countries to happen. Now, all these four explanations and some other similar ones are based on racism, and I'll tell you why. All of them depend upon the Africans doing nothing. It's genetic. It's it's because it's such a bad place and everybody's sick, or they've got some kind of drugs like TB against TB, but it's nothing that they actually did themselves. It's something that exterior to them. So let me share another screen. What happened to my other? Oh, here it is. Now, not all Africa has done well. Here's a chart of South Africa versus the United States. And you can see that compared to the United States, it's not, or compared to Kenya, which was right there on the bottom line, South Africa did very, very badly, and is the country that's done the worst in Africa. So any of those questions about genetics or the fact that of the giving the drugs for TB, they do that there in South Africa, and so that didn't help. So those kind of explanations are inconsistent with what happened in South Africa. So let's think a little bit about what were good reasons why Africa succeeded where the United States did not. The first one is when the virus began to spread around the world, a country like Kenya responded very quickly. As soon as they, for example, that when Wuhan and northern Italy had a lot of cases, Kenya stopped all flights from those places in the world. And it wasn't shortly thereafter, as soon as they had the first few cases in Kenya, which were all imported from, obviously from other countries, they did not allow any flights into the country. They stopped all flights, and so they reacted very, very quickly. And when things began to increase a little bit, let me share the Kenya screen. You can see this is the screen has both the number of cases at the dark blue line, and then the dotted line is the deaths. And you can see they tend to more or less go together. When the cases began to increase in Kenya, one of the reasons that it didn't jump up like it did in the United States is because, okay, the first one was that the quick reaction by the government to put restrictions, ask people to wear masks, and there's no anti-mask lobby in this country. And not a lot of people don't wear masks, and they don't wear it properly and stuff like that. But you go into any shop, you have to have a mask on. They take your temperature, they make you wash your hands to get into the shop. I was just shopping today in Eldoret, the town nearby, and I had to do that. But for TB, since it's things, one thing that they do in Kenya is contact tracing, so that if somebody has TB, they find everybody in their family and other people who've been close with them, and then test all those people for TB. Now, so there's a whole system set up in the country of doing this. And So when COVID-19 came, they did tracing, plus they increased it by a lot. They trained a lot more people. And so one way of keeping the amount of the virus from spreading is that they would put in isolation or quarantine anybody, all those like 20 to 40 people who were in close contact with anybody who was positive, and for 10 days, and test them. And so those close people were isolated and were not therefore out there in the community spreading it on to lots of other people. So you see that about August 1st, there was the first peak. And then the government put in all kinds of very strenuous restrictions similar to what had done elsewhere, but although they didn't lock down any of the country. They did keep people from leaving Nairobi, where about half the cases are in the city of Nairobi. And this worked very well. And this, you know, the masks, the hand washing, the distancing, the bars were closed. Churches could only have a 25% capacity. There were no large gatherings, things like that. And you can see that by the middle of September, the rate had really decreased tremendously. So just doing those things that you're supposed to do work. And they work actually quite well. Now, they're not going to eradicate the disease, but they're going to keep it under control. Well, when that happened, the government relaxed their restrictions. The 8th graders, the 12th graders, the 4th graders all went back to school. They stopped enforcing a lot of the different things. And you can see that there was a second rise as people relaxed. So you can see about the middle of November, there was the second peak. And so then they, you know, re-emphasized restrictions, put new restrictions on, and forced, you know, made sure that people were wearing their mask and hand washing and things like that. And you can see that by January 1st, the rate went way down. Now in Kenya, over Christmas holidays, from right before Christmas to after New Year's Day, everybody who lives in out of their home area returns back to their home area to celebrate Christmas. The buses are packed. The roads are jammed sometimes, things like that. And so they were very worried that the people from Nairobi, where half the cases were, would take the cases to the countryside, and people in the countryside who tend to be older would get the thing. So you looked right after that and you see there was just a very, very small increase about, you know, from January 1st to maybe January 7th or 8th. So in fact, even though people did travel in buses, and frequently those buses are way overpacked with people, the rates didn't go up. And then when the rates went down this time, the government did not relax, and then did not tell people to relax as they had the first time. And so you can see from most of, say, middle of January to middle of February, it was pretty much equal. Although now there seems to be perhaps a third wave beginning to come up. One more thing, at you know, the idea that Africa didn't have enough hospitals and things like that, ICU units, oxygen, even oxygen units and the oxygen itself. So at the peak in the middle of November, the various hospitals and they, as soon as back there in March or April, they started having every county, there are 47 counties in Kenya, build hospitals and isolation wards and everything else you needed for each county. In November, particularly in Nairobi, almost all of those beds, in fact, all of those beds, all the ICU beds were full. But when it went down by January 1st, right now even there's unused capacity in Kenya because it's been contained, so not so many people are getting sick. And as you can see, a lot less people are dying. By the way, the whole number of people who have died from COVID-19 in Kenya to date is, I think, 1,875. That's less than happens in one day in the United States. Now, another reason why Kenya and other African countries have done so well is because of Ebola. If you remember the Ebola thing in West Africa and sometimes in the Democratic Republic of Congo, the health systems have to react very quickly to isolate people, to help them out. And now they have vaccines, but they didn't till recently. And so because of Ebola, all the countries in Africa had pre-planned what would happen. Well, Ebola didn't happen like in Kenya, but COVID-19 did. And so the plans that they had for Ebola, they just moved over for COVID-19. One other theory, which is actually one of my favorite ones, in the 1918 Spanish flu thing, the hospitals in the United States were totally overflowing at times. And so they had to put people outside in the sunshine and in the fresh air because the hospitals were full. Well, they found that those people recovered more quickly than the ones that were actually inside in the hospital. In Kenya, people, and my son, who actually lives in the United States, sort of said he was amazed about how much time people live outside in Kenya. Where we live, there's no heating, there's no air conditioning. We keep the doors and the windows open pretty much all the time. The wind blows, and there's not the confinement that you get, particularly like in the wintertime in the United States when it's cold and everybody's inside. And of course, they found that even sometimes the heating systems and the blowers are spreading the disease. Well, none of that kind of stuff happens here in the United States. Now, I want to compare the countries around Kenya. And these are Kenya's neighbors. The blue line is Kenya. You can see it's very similar to the one that I just showed you. The green line is Rwanda, and this again is per 100,000 people, so that they're comparable. And you see that Rwanda had a small first phase, then did pretty well, then had a very quick second phase, and then came back down again. You see Uganda had very few cases, had one spike in about in the middle of December, and is down to very, very few cases. And then you look at Burundi, and they've had almost no cases. The number of deaths in Burundi, and Burundi has 11 million people. It's a very small country, but it's thickly populated. The total number of deaths from COVID-19 is 3. So the countries, Burundi and in Uganda have done better than Kenya, and Rwanda most of the time was doing better, but except for that one time when they're spiked. Now, I don't want to whitewash things or make things better than they are, because Tanzania is another country right next to Kenya, right south of it, and it has done atrociously. The president is a evangelical Christian, and in April or so, he said, "We pray to God. God has answered our call. There's no COVID-19 in Tanzania," and therefore they did none of the restrictions, no mask requirements, no social distancing, none of those kinds of things that all the other countries were doing. And moreover, everybody is supposed to report to the World Health Organizations their daily number of cases, the deaths, and so on and so on. Well, in April, Burundi said we're COVID-19 free, and so we're not going to report anything more. Well, that was clearly not true, as truck drivers would come up from Tanzanian truck drivers across the border. They would be tested, and sometimes, of course, they were positive. So what happened was that that COVID-19 has just spread all over. Recently, the vice president of Zanzibar died of COVID-19. A total of 9 other high government officials are supposed to have died of. Now, you can't say in Tanzania that they died of COVID-19, but they die of clearly symptoms of people who have COVID-19. The Lawyers Association says that 25 of their members have died of COVID-19. The Catholic Church says that 60 sisters and 20 priests have died of COVID-19. A friend of mine who was in the Peace Corps in Tanzania with me had a contact in Tanzania who said he knew of 12 people who died of COVID-19 in the last couple of weeks. So the president of Tanzania has now sort of backtracked a little bit and saying, "Oh yes, we do have COVID-19 in the country." By the way, about 2 or 3 months ago, the U.S. government advised Americans not to go to Tanzania because of the COVID-19 that existed and was denied in that place. So here you have a country with, essentially total denial, and how severe it's going to end up becoming, I don't know, and it's not even clear that the government is going to give anything like proper accountability of the number of cases and the deaths. Some other very interesting things have happened. One of them is, you remember where I talked about that they did the tracing, the contact tracing? Well, when they did contact tracing, they found that 80 to 90% of the positive cases were asymptomatic or so minor that people didn't even go to the hospital or even notice that they were something wrong with them. There's been about a total of about 100,000 cases in Kenya, and about 50,000 of them or so, probably more than that now, are in Nairobi. And they did one of those studies where they took 2,000 people and to find out how many have had the antibodies to the COVID-19. And they found that about a third of the people had COVID-19 antibodies, which means that they had the disease, but of course they had no symptoms. Now, Nairobi's population is like over 4 million, 4.5 million people. So that means 1.5 million people in Nairobi maybe have had COVID-19, although the official number is 50,000. And so therefore, almost everybody who's had it, I would say well over 98%, were symptom-free. Now they did a similar study in Lagos in Nigeria and came up, I think, in that case with 23% of the people had antibodies. So I think the lesson here is, COVID-19 is new and people don't really understand what's going on, but here's something that needs a really interesting explanation. And I think other places they found, other parts of the world, that the number of people who have the antibodies is much high. It's much higher than expected, let us say like that. Well, not everybody has a picture anymore, but how many people have had the vaccine? Raise your hands. You know how many people okay. The vaccines, and it's AstraZeneca, were just the first vaccines to Kenya were delivered Wednesday. And today, the first vaccines, and a million vaccines were sent for, which will cover about 500,000 people because you need 2 of them, of course. And so the first few people, like the president and people like that, were vaccinated today, and they're distributing the vaccines to the various parts of the country. And they have the usual protocol of who gets the vaccine, and these first million are supposedly going to go to health workers of all kinds. So far in Kenya, last I read, was 14 doctors have died of COVID-19 in Kenya, and about 35 nurses and other health people. When Kenya, you needed face masks and you needed ventilators and all those kinds of things. In March, you couldn't get them. So Kenya started manufacturing them themselves. I can now buy a R95 mask in Eldoret for $1. And they're making masks by the tens of millions, I guess. And every, they're there. But they also didn't have enough oxygen. So they've set up the oxygen machines, and some Kenyans have developed their own ventilators, and so on and so on. So, thinking that Kenya is a basket case where, oh, we can't do anything, they're so poor, and, what the Red Cross and the Save the Children and UNICEF try to project as to what Africa is like is not what it's like at all. And so Kenya was able to respond. So the vaccines that they expect to have now will cover, by June, they want everybody, they want health workers, teachers, policemen, other in government officials, people that interact with the government, to be to have two shots. Then from June, now May in the United States, everybody in the country is supposed to have 2 shots that wants to have it, as I understand. So, the United States, Kenya is going to be way, way behind the United States as far as vaccine. And that's true of all of Africa by an amazing amount, as the wealthy countries in Europe and United States and elsewhere have gobbled up all the vaccines. Some places have many more vaccines than they even need, and they are unwilling to send them off to countries who need them. So after that, the second priority, which would starting in July, if if they get the vaccines that they're hoping and planning to get, would be vulnerable people like elderly people, people with diabetes and heart hypertension, like me. And they hope to cover everybody in those categories, and also, other those categories by the next year. And that's still only, I forget exactly, something like 20% of the country. And so it will take till 2023 to vaccinate everybody in Kenya, which is supposed to happen in May in the United States. So if anybody wants to lobby, you can lobby the Americans to, and the Americans, oh, by the way, the vaccine we're getting in Kenya is manufactured in India, which is one of the biggest countries in the world to manufacture vaccines. And anyway, those are kinds of problems like that exist here in Africa. But on the other hand, if Africa has so few cases compared to certain countries in Europe, and Europe's still doing badly again, and the United States and places like Brazil and India. Well, India seems to be getting things under control again, because they are manufacturing lots of vaccines to give to their people there in India, although of course they have a tremendous population. So back to my thesis was, you can see how Africa is discriminated against, how the reputation that is held by so many people is very, very negative about Africa, even when it shouldn't be. In this particular case, we have to say, except for maybe South Africa and a few of their surrounding countries now, Africa has done much, much better than Europe or United States, Mexico, Brazil, and lots of other countries. So I guess it's supposed to be time for questions or comments, and so I'm happy to do that.
Wonderful talk. I really wanted to hear this. I gave a talk to the same group earlier, I don't know, a couple months ago, maybe, or December, I think it was, I called it Reframing Reality for the Coronavirus and Racial Justice, and what was my other topic? Anyway, age. And I mean, in the US, it's clear that the Trump administration is one of the reasons why we did so poorly, because they didn't take it seriously. And Trump was more concerned about, giving an image that everything was fine for his reelection and so on. So I could go into a whole lot of that. But I also was part of a conference. International Peace Research Association had our annual conference. It's every 2 years in Nairobi, Kenya. And it was just in the middle of January. And of course, a lot of people from the US just went online to join it. But it seemed that a lot of the people in Kenya were doing pretty well, and they were there, and other Africans were there, but not as many people from Europe and North America. And so it fits perfectly with what you were saying. And I mean, I think I found your talk fascinating. I took some notes, and I think it's much more of a model of what we should all have been doing. And so thank you so much. I mean, it's very good. There's either like you take, like you mentioned, either you take it seriously at the beginning and you do contact tracing and wear masks and social distancing and everything, but we weren't doing any of that. And we're still not doing the contact tracing very well. So, but now we do have vaccines finally. And there's some people who, are anti-vaxxers who are worried about taking the vaccine, but, at least more and more people are beginning to get it. And there's still an issue of getting the vaccine equitably distributed to all different population groups, and so on. But I think we're in better shape now with Biden and by, you know, and after the election in November when Trump lost, but he's still saying he won, he did absolutely nothing. I mean, he just became AWOL. He wasn't in charge of trying to do anything anymore. And before that, he had somebody named Axel as his main advisor for a while, who was advocating the herd immunity, just let everybody get the virus and don't do anything to try to stop it. So kind of it was a case study of everything not to do. But I'm very glad to hear that Kenya did so well. That's wonderful. Thank you so much, David. Very interesting.
David, I'm so glad to hear that Kenya is doing well. The U.S. could take an example from you in terms of the contact tracing and what have you, which is still not going on here. My question is, I'm wondering, since Tanzania is in total denial and things are getting to be a very dire situation there, are the borders open? Can people from Tanzania come into Kenya, or how are you dealing with that situation?
In all African countries now, pretty much, in order to cross the border, you have to have a negative test virus in the last 3 days.
Oh,
72
great.
hours, no.
Mhm.
Yeah. And truck drivers, I mean, particularly earlier, the trucks waiting to get from, say, Kenya to Uganda were parked for weeks while the drivers were trying to get their their certificate
Oh, dear.
thing. And the same with Tanzania. And that's when they found that, you know, the truck drivers were coming across and they would test them and they would find that they were positive, some were positive. So that means that there was the virus in Tanzania. If you want to come well, I know 2 Americans who work here in Kenya. Both of them are Quaker missionaries, and they went home over Christmas time, and they had their schedule to come back, and they couldn't get a virus certificate from the last 3 days. They didn't get their results back in time, and they had to cancel their flight and then try again. One of them was able to succeed the second time. The other couple decided they would wait in the United States for an extra month and get both vaccines shots and then come back with the vaccine shots. So, you know, there's very strict controls on these kinds of things.
I'd like to thank you, David, for this very important presentation, you know. But it seems to me that, you know, beside that, this systemic problem, we don't hear this kind of news outside the United States, or at least, it's, you know, we're limited in hearing many of this good news coming from a different country like Kenya and so forth, you know. And maybe my question to you is that, how can we disseminate many of this important information here in the United States? Because you know, we have about 500,000 people died on this dangerous virus, and so, you know, maybe you can help me to do that, or maybe social media and so forth. Thank you.
Let me just make a comment that's sort of extraneous, and then I'll come back to your point. I know 7 people in the United States, I mean, personally know 7 people in the United States who have died of COVID-19. And ironically, one of those 7 people is a Kenyan. I know of no Kenyans personally who have died of COVID-19. In the United States, I know lots of people who have had COVID-19, including my granddaughter who goes to the University of Ohio. In Kenya, I know of only 1 person who has been COVID-19 positive. The point for all this is, back to your statement, is Isn't that what this organization is supposed to be doing? Disseminating this kind of information to wherever you can, be it letters to the editors, even on Facebook, complaining when people do things different, say things, remind people that there are other parts of the world that have done very well, things of that sort. So I'm sorry to pass the buck on, but this is your work, not mine. Mine is to do what I can here in Kenya.
Yeah, because we don't hear
Um,
this kind of, this kind of news from outside the United States.
First of all, thank you. I found that absolutely fascinating. I mean, when I've been looking at statistics, it always seems to be islands, and I'm including Australia as an island in that, where there's a definite boundary around it that keeps the virus at bay. So for this to happen, where you've got, as you say, Tanzania next door, which is rife with it, South Africa down the road, and it's all landlocked, I find just incredible. But my kind of question and concern is that I just see this virus as like water, that it's going to spread everywhere eventually, and there's going to be kind of equal level of it. How confident are you that you will actually be able to keep it at bay in Kenya, and that we're not going to, when all the rest of us have forgotten it because we've all had the vaccine, it'll suddenly become a big thing in that area?
I live in a county called Kakamega County, which has about 500,000 people. There's 0, 1 or 2 or 3 cases per day in all of Kakamega County. I live in Lumakanda, a small town of 1,000 or so people, and countryside around it. We've had no cases here, and this is a small community. If there was a case, everybody would know real quick, and unfortunately, they would isolate those people in that family who things. There's been, your idea was, well, they've done really well, but it's going to come, the flood is coming down the way, but it never happened.
My fear,
Yeah.
not idea, fear.
Right, that it's going to happen. I don't think, well, once they start vaccinating people, I don't think that's going to happen. On the other hand, I don't think it's ever going to be eradicated. Like, New Zealand, went for I forgot how long without any cases whatsoever. Well, I don't think that's going to happen. But I think that particularly, when the health people and teachers and policemen and people like that get vaccinated, that's going to really cut down on the transmission. And so I'm fairly confident that Kenya and the other countries around here, except Tanzania, are going to defeat the virus.
Thank you, David, very much. Really a eye-opening presentation. I have a few questions on COVID, and if the line finishes up, I had a general question on Kenyan healthcare generally. But on COVID, to help us do our job, as you challenged us a moment ago, I have 2 questions. Could you express in rate of population, you mentioned that there have been 1,875 deaths in Kenya and that the rate is 45,000 times higher than the United States?
No, the number of cases in the United States is 45 times per 100,000 people. So Kenya only has 47, 48 million people, so it's much smaller than the United States. But you take for 100,000 people, the United States has 40 times the number of cases that Kenya has had per 100,000 people.
So that's the best 40. We have 40 times the cases of COVID per 100,000 people compared to Kenya.
That's correct.
And you're saying cases, do you know that in terms of deaths?
I think it's similar. I haven't done the actual statistics, but if you look at the charts, the cases and the deaths both in the United States and in Kenya follow each other, although the deaths, go a little long, happen a little bit later because people, take a while to die.
Right. And lastly for me now, either in the chat or after this program, do you have reports from Reuters or Kenyan news services or any other published reports that lift up the Kenyan experience and the success that Kenya has had in addressing COVID so that we can cite those published reports in our work?
I read everything I can find, and people, and I send out a report from Kenya every Friday, and I have about 1,000 people on that list. Anthony's on it, and I also put it on my Facebook page, which I'm at 5,000 people, which is the maximum you can do. And so I report each week about something about Kenya or Africa usually. But frankly, I have not found any I found some good documentations on one aspect or another, but for every one that I find that's fairly decent, I find 10 that are pretty bad. For one reason or another. And I can probably look up some, it will take me, I don't think I could do this tonight. It's already late for me. But if I could give you a couple of, I could look through my files and see if I can find a couple of them. One of them was a really, really funny one about Africans reporting about what's happening in the United States in the same way that the United States normally reports about Africa. Done by a person from Reuters, I think, who a long time ago was in Nairobi as a Reuters reporter. But anyway, I'll see if I can find things and I'll send them to you, Anthony, and then you can forward them on.
Yes, as I step back, David, this sounds like an op-ed written by you and submitted to Reuters, the International Herald Tribune, the New York Times. You have a perspective that needs international attention.
David, this is totally amazing. I did a screenshot of a couple of your graphs. Could you give us either in a chat or a future email to us the website where you got that? And the other question is, do you know anything about Cuban doctors in Kenya or anything about the prospects of the vaccine that's coming out being tested by Cuba and Iran that is intended to go not to the wealthy countries that could buy it, but to the countries that most need it?
Well, AstraZeneca is used in lots of places, but it was tested partly in Kenya. When they were doing the trials, they did some, they took, I forget how many, it was 500 or 1,000 people in Kenya, and they did South Africa were part of the trials for that vaccine.
Oh, interesting.
So, but again, Kenya, you're gonna see as the vaccine is administered, if there's negative reactions, it's gonna get in the news here. I mean, this is actually probably in certain respects, the news in the United States is more circumscribed than it is here in Kenya. In Kenya, you can say pretty much anything you want to it now. Well, and it's not controlled by the, big media as the United States, which, the big TV and radio and New York Times and Washington Post dominate everything in the United States.
My other question is, would you give us the website for the charts that you used?
Yeah. Yeah, that's easy.
Oh, thank you, David. As usual, you are dispelling stereotypes that many of us have. I don't have to repeat what our former president said about Africa, but so I've read that 130 countries have not gotten any vaccine yet, and including apparently Kenya, which is just getting it now. That is a real issue for us of social injustice. And I'm wondering what you would recommend those of us who are concerned about justice, what we can do to ensure that vaccines are expedited to places like Kenya and others that, even though you've done extremely well in Kenya, ultimately, a lot depends on getting everyone vaccinated. So is there anything you could recommend for us to do to make that happen?
I think you can push the administration and particularly the foreign. I mean, when things started, you know who Jack Ma is, the wealthy Chinese guy? In March and April, he sent masks and all kinds of other things, ventilators, to all African countries from his foundation. The United States has not done anything comparable. In fact, they're almost not. They're out of the picture here, and I think that's true. In much of the world, that the United States just has been so inter-focused, "Make America Great," that they have to look at what's happening. The United States has to react to what's happening in the other parts of the world, and it's important for the United States to do that. One of the reasons that South Africa had so many cases is because they had a variant that was much more contagious than other places. I mean, England has also had one, and that's spreading around the world, and it's actually come to the United States. So if South Africa or any other African country don't control the virus, sooner or later it's going to come to the United States, and maybe the vaccines that they have right now aren't going to work for that. So I say the same things that I answered to Fernando was, you just have to promote this wherever in any way you can. Yeah, you got a lot of Quaker meetings you can talk about.
I just wanted to, point of information, the graphics that David showed us, the graphs that he showed us were from Johns Hopkins, which is, I believe, the gold standard as far as U.S. media are concerned. I'm not saying purely gold standard by any measure, but I know that CNN regularly uses figures from Johns Hopkins, but I have never seen any Johns Hopkins numbers or graphs on any of the major media. So the information is available. It's right there, apparently, on the Johns Hopkins website, because David got it all the way in Kenya. And it's a case of the information simply not being distributed in a responsible, diligent fashion. And so, I do think that ICUJP could help to begin to spread this information. And I wonder if maybe there are a handful of non-racist and diligent journalists who thought about spreading this information, but were worried that the general population in the United States, hearing that Kenya has a very low infection rate and an extremely low death rate, might say, oh, They don't need the vaccine. We don't need to think about them. They're taking care of themselves. So let's gobble up more vaccine for ourselves and forget about Africa. But that's just a thought. Next on my list, I have Maggie. Unless David wants to make a comment. David, do you have any response to my rant?
Well, yes. I mean, that's a typical American response to things. And you just have to counteract it. As I said, if a virus in South Africa comes to the United States, you may be in bad shape again. Okay, Maggie.
I just heard it initially. I love your talk. It's just so wonderful to relate this to racism as clearly as you have. But I did hear that Sweden had been using herd immunity. And I wonder, statistically, how's that working for them?
Well, from what I understand from Sweden, it's been a disaster. And they've since decided not to do that anymore. But one of the possibilities, I didn't want to discuss it too much because it's just a possibility, is that if, 30% of people in Nairobi have had the virus without symptoms, that perhaps herd immunity is beginning to kick in. But it's not clear if that's true or just hopeful.
Hi, David. I just wanted to say hi. I don't have a specific question regarding COVID. My wife and I, my wife is Ugandan. She's in the kitchen over this way. We work in Uganda. We do a lot of work with HIV positive people, and we do some permaculture farming. We currently have a friend that we're dealing with a serious cancer case. And I'll be emailing you later. Anthony connected us by email. I've been a little negligent to reach out to you, but I will send you an email. I just wanted to put a face with a name. We're looking for some connections in Kenya because of violence in Uganda, possibly needing to evacuate, like during times of election. So we need friends in Kenya. So anyway, I'll send you an email, but thank you so much for your presentation. It was very informative. I specifically appreciated the analysis of possibly the warm weather being outside being the reason that we see so few cases. Ugandans are incredibly negligent for mask wearing and social distancing, and we've been waiting for it to explode in Uganda, and it hasn't. So that may be the reason why.
I read your book.
Paul, we lost you.
Yeah. Yeah, so my wife and I have been debating this for some time. Why is it that Uganda hasn't exploded? So thank you very much.
As I said, I've read your book. I bought it and read it.
Which book is that?
Oh, I forget the title. Maybe it's not you. Maybe it's somebody else that I have from.
No, I haven't read a book, but I did send you a Facebook friend request, and you're not up to 5,000 yet, so you don't have an excuse.
No, I'm not under 5,000.
No, you're 4,950. So me and my wife will send you a friend request. I've been looking at your stuff. It's really good.
Yes, thank you so much, David, for really that great presentation and those graphs, which I'm going to post on Facebook really quickly as soon as I get off this call, to make people aware in this country that, all things white don't necessarily work well. And perhaps it will be a wake-up call. I had talked to a friend who's a president of a school university in Beni in DRC in Congo. And this was maybe about 4 months ago. And we had a Zoom conversation in which he really corroborated your same things, that Ebola prepared them in Beni area anyway for knowing what to do should the coronavirus hit. And they've been doing protocols on that, but it really hasn't hit. So we're very grateful for so many ways in which Africans have been ahead of the curve and are teaching us a lesson. I want to ask you a specific question about the economy, because when the pandemic first started, you know, things were closed down and we were sending money to close friends in Kenya who were really hurting. What's the situation now from your perspective, you know, as in a broader scope in terms of the economy and how it's impacting people?
Well, the economy really did take a big hit. And it's not just because of what happened in Kenya, but I mean, like cut flowers was one of their main exports, and to Europe mostly. And, you know, all of a sudden that completely dried up. But now it's back to pretty much normal again. You know, Valentine's Day just went by. And so it took a big hit. And particularly those people, you know, a lot of people in Kenya work day by day, the day laborers are small, very small one-person businesses. You know, they make something or sell something, or the women do a lot of resale. You know, they buy tomatoes wholesale and then sell them in their towns and things like that. So all that kind of stuff really hurt people a lot. But the actual economy only did not contract. It went last 2020, it went up only like 1% rather than 5 or 6% that it had been expected. So it's the economy is recovering. But I don't know if it's back to where it was, say, January of last year or even February of last year yet or not. But exports and things of that sort have returned to more their normal amounts and things of that sort. And Kenya, by the way, is a middle income country. It's not poor.
Yeah.
You go to Burundi, Eastern Congo, you can see really poor folks, or South Sudan. But Kenya, particularly the area around Nairobi and stuff, is quite well developed.
Which is another way.
I could give you a whole nother lecture on the things that Kenya does better than the United States.
Oh yes,
economically.
For sure. And of course, the media only gives us the you know, the stories of Kibera and Mathare Valley and, you know, places like that. And those are the only pictures or images that we see. So of course people think, oh yeah. So thank you for that. Thank you so much again.
Big effects in the US from the whole thing, because we didn't deal with anything properly at the beginning, were that we had huge hits on the economy here and jobs, which Grace was just talking about, which was part of my question. And I guess the other one is the effect on schools. You know, what happened with kids in schools during all this period in Kenya?
In March, when things started getting bad, they closed all the schools. And my grandchildren stayed here until January. Now, they did reopen in October for just 4th grade, 8th grade, and senior in high school, which would be like 1/3 of the students. So yes, and now, so kids are behind. Now, my kids weren't, because I did lots of things with them. I actually kind of enjoyed the time with them. But, you know, students forgot what they had learned and they had to pick it up. And what Kenya is doing is normally there's 3 terms a year. Now they're stuffing 4 terms a year, cutting out the much of the vacation time and cutting each term down a couple of weeks in order to fit it in, so that by the end of 2022, they'll be back to school starts here in January. So the school would start in January again. But they say it really is hurting the students it probably, I mean, I'm sure what has. One of the big issues is that the number of girls who've gotten pregnant because they're not in school and they're at home a lot, and so there's a lot of abuse. And that's a big issue here in Kenya, though. And again, Kenya, though, has now opened schools for those girls who are pregnant, special schools for them, and then they stay there with for like the first year when they have with their baby. In Tanzania, being a very evangelical Christian place, if a girl gets pregnant while in school, she's not allowed to return to school.
That's where that was.
Tanzania.
Wow. Wow. Let me just say that I'm hoping now that we don't have Trump as the head of our government, that after we can get the cases down in the US, which are starting to happen, that we'll start also helping out globally.
I hope so too.
Yeah. Thank you, David.